Yeah, thank you for the introduction. Thank you for inviting me to speak here. My name's David. I'm originally trained as a physiotherapist about 20 years ago, and I developed Rehab Guru with some colleagues. That was originally a passion project that's now turned, thankfully, into a successful business. So what I'd like to speak about is market access, how we're selling the product, the key factors for success, the user feedback we have, and some of the research that we're starting to generate. Is it okay to ask for the next slide, please? Thank you. So as I said, it was founded by a few of us. It is still owned and led by all of the clinicians. And what we've done since lockdown is realized increase in revenue, thankfully, to people transitioning over to digital care. And we've reinvested that to turn Rehab Guru from an exercise prescription platform where you would send exercises to now having tracking and monitoring of various different health outcomes, allowing therapists to have more data that improves their decision making. Is it okay to have the next slide, please? There should be one before that. I think it might have gone forward too.
That's the only one I got, sorry.
Okay, all right then. I think I updated the slides a few days ago, so these might be the old ones. So I will go from here. So what I'm going to focus on is specifically selling to the NHS. And the reason for doing this is that we provide to military organizations, we provide to private medical insurers, and we've created Rehab Guru with a philosophy of build it and they will come. And that certainly happened, but that's quite a boring story. We created it, we sold it. The biggest challenges and the biggest learnings have come through NHS procurement because it's a completely different organization. The NHS is a renowned organization around the world. However, there are huge challenges in the UK. And the NHS long-term plan recognises pulmonary rehab because people that have experienced lung cancer, cystic fibrosis, emphysema are struggling to access the care. Only 13% of eligible people can actually access pulmonary rehab, and it's also incredibly expensive. One of the things that we've been able to do with this information that we have in the new data is to do some joint research, which is recently published. Is it okay to move forward to the next slide, please? Thank you. So what makes Rehab Guru different? Rehab Guru is very similar to many products out there. We joined the market, we tried to sell to the NHS, and we actually had a huge number of problems because we were just like any other platform. The NHS does not have centralized procurement. It only buys from one trust to another, and they have the authority to buy what they want. And the cost for our software is so small that they have no regulation, that these smaller physiotherapy departments are not regulated by any commissioners. And so it's really an individual's opinion. And so if you're trying to break into these organizations like the NHS, you need a lot of evidence, and you need to evidence what is unique about your platform. So at the moment, what makes it unique is the exercise library, the fact that it is so unique. We do offer telehealth, and we also have developed these patient-reported outcome measures. So some people have presented on measures like the HAD, the GAD-7, and various different patient-reported outcome measures that give more data to their therapist to improve the quality of the decision-making. And there is also remote tracking. So when you send an exercise program, it's not simply a post and ghost. You send it with tracking of health outcomes like in respiratory would be breathlessness, Borg, modified Borg, or if it was respiratory, sleep quality, pain, fatigue, so on and so forth. Is it right to move to the next slide, please? So these are some of the organizations that we provide to. Those on the left have just approached us, and we've been very fortunate for that because of the software that we provided. And the ones on the right are the ones that have since been rolled out as a result of this NHS research that we've done. Is it right to move to the next slide, please? Thank you. So what is unique about the exercise library? Traditional exercise libraries are demonstrated by models who are all white, who are all very young and very athletic. So when we see patients who have suffered strokes, who have suffered ischemic heart diseases, they don't look like those people. And it's really important that the exercises are demonstrated by people that make the exercises seem accessible and attainable. There are also many exercises that you will all know for if you're working with Parkinson's disease, if you're working with stroke, you need to have exercises with partners, some for vestibular training and whatever not. And there is actually a big gap in the market for that. So that's been really helpful for us. Is it okay to have the next slide, please? Telehealth. Telehealth is something that became really popular over lockdown. However, within the NHS and within the UK, we've seen a real withdrawal of it. So we have free services. We have a free service for telehealth, which is fully encrypted. And we now have what is really popular for the NHS. And if anyone is looking to access the NHS don't want any of our free telehealth versions, and they don't want a paid telehealth version because they don't have enough manning within their cybersecurity departments to be able to audit and regulate and approve another piece of software. So what they currently use is Microsoft Teams. So having an integration, be that from an open API, or we talked about Fire and HL7, those are most well accepted. And the reason they're most well accepted is because they're already used. So the therapists don't have to change what they're already doing. They just continue using the software that's already in place, that's already been approved by their cybersecurity team, and that's already been paid for. Is it right to move on to the next slide, please? Okay, so what is unique about the patient-reported outcome measures? Why is it that we were able to get research, and what is it that makes this data worth researching? So for a therapist like myself and some of you that are therapists or work with therapists, huge amounts of time every day are taken up with form filling, calculating forms, and being able to get it on with your patients is really restricted. It's really helpful to be able to triage your patients, but you traditionally have to wait for that person to come into your clinic before you can triage them. So what these prompts allow us to do, and is what is allowing the therapist to do, is to triage the patients and then select those who they are going to see remotely, who they are just going to send an email to and send them a note of encouragement, and those that they feel that they need to bring in for face-to-face appointments. So this allows people to manage their time much better. And the data that's come out with this pilot research is very, it really promotes this and says that we're saving the NHS a huge amount of time. Is it okay to move on to the next slide? Thank you. So this is an idea of some of the data that's available for the therapists. This is the data that relates to an exercise program. When you send a program, it's not simply a program that the patient gets on with and then tells you about 2 weeks later. There is tracking for compliance, so you can see those that are doing it and those that aren't. It also tracks step count, so that you have an idea of how people are getting on outside of that 30-minute window when they're doing their exercise. And you can also track various health outcomes depending on whether it's respiratory, whether it's neuro, whether it's MSK, orthopedic, so on and so forth. And this feedback just allows people to make a better decision. And for the purpose of this presentation, when there's been so much presented about neuro for those people that are having cognitive challenges and they're having processing challenges, memory is a problem. This sort of stuff can be done with a carer or inputted by the patient so they don't have to remember it when they get to the next appointment. Is it okay to move on to the next slide? Thank you. This is what it looks like for the client. So how is the client engaged? How do we boost compliance, as it's been shown with the research we've done with the NHS? The patient's able to engage with our app, which is completely free for them, so they can look through the videos. And then the second image, you can see the sliding scales that they use to rate their pain, their fatigue there, whatever it happens to be. And then the app shows them their feedback so they can see the progress that they're making, they can see their step count, and they can also set reminders. They can have appointments, telehealth appointments with their therapist through the client app. So this reduces the number of platforms that a patient needs to engage with. And that's really important, particularly if someone's had a stroke or another condition which affects their cognition. Sending them lots of complicated software to deal with is quite difficult. So we just bring this into a wellness app. Is it right to move on to the next slide, please? Okay. So what did the research find? It was compared, as is all things within the NHS, to the NICE guidelines. And there's been some mention of Cali. So how does Rehab Guru cost compared to traditional care? And it was far below that of traditional care. But what the NHS is more interested in is not necessarily can you save us money, because their budgets and funding are secured. What they want to know is, can each therapist treat more patients a day? Can they manage their caseload better? Can more people be discharged or kept out of hospital and for the same funding? And the evidence that's come out of the pilot study this summer is really effective. So, for example, for every 43 patients that use Rehab Guru for their therapy, we can prevent one admission. And for those of you that know how expensive hospital admissions are, with the cost of staff, cost of medication, the cost of bed, the cost to the family, the cost to society, and hospital transport, this is a huge saving. And a lot of the staff gave really good feedback, as did the patients. So a lot of the patients, we engage with patients both through the patient, but there are also some patient engagement groups within the NHS that we've used in order to gather lots of data. An example of that is the National Institute of Health and Research. So if anyone's looking to get into the NHS and scale, there are organisations, the NIHR and also the AHSNs, the Academic Health Science Networks. Those are the organisations that we went through. And the reason we went through them is because we were trying to sell to the NHS. The NHS didn't believe that, that what we were telling them. And so we needed to gather research. And so if you're looking to implement your software and partner with people, those are the two organisations that I would recommend going through. Is it okay to have the next slide, please? The challenge that we have, and I think a lot of people have with accessing the NHS, is the regulation. So data regulation, security. Most people here will have heard of ISO 27001, and that normally is satisfactory for all the military organisations we work with, all of the private medical insurers, and so on and so forth. However, the NHS do have their own specific ones, like the NHS Toolkit and DTAC. And so those are things that just constantly need updating and need to be achieved before you can access the NHS. Is it okay to move on to the next slide, please? Integrations is another one that we have spoken about. A big obstacle for us, and the main reason we actually evolved and started creating the patient reported outcome measures, writing your patient notes, appointments and whatnot, is because we hit a lot of roadblocks when it came to trying to partner with electronic health records like EMIS or Rio or any other ones that were out there. They really wanted to ring fence their data, and a lot of them either didn't have the staff or the know-how to create good integrations with open APIs. And so we connected with FHIR and HL7 about 5 years ago, and we're still waiting for other tech companies within our industry to do the same. So we just have to create lots and lots of other integrations. And so if anyone's wanting to access the NHS, rather than just expecting everyone to have already got hold of FHIR and to integrate with them, unfortunately, it's not that easy. It is still a very old, archaic organization. And so if you want integrations, you have to make them specifically. Is it right to move on to the next slide? What's next for Rehab Guru? Those translations are very important, both for the British population, but also for the rest of the world. The data that currently is collected by Rehab Guru improves decision making for therapists, but we're going to start working with AI. What this will look like is suggestions on automated progressions. So if, for example, someone's pain score is reduced, someone's fatigue score has reduced, and their sleep quality have improved over a 1 month period after they were sent the program, there will be suggestions made by Rehab Guru on suitable progressions that allow the therapists a much shorter period of time to gather the data and then approve those progressions in cases where the people are doing really, really well. We won't be providing that data to try and get rid of the therapist or to tell them how to do their job, but just allow them to manage more patients with the same amount of time that they have. Is it right to move on to the next slide? Thank you. That's the end of the presentation.